pregnancy is counted as 40 weeks starting from the first day of mother's last menstrual period. Your estimated date to be above will give you a guide. Babies comes when they are ready and you need to be patient. The gender and characteristic of the baby is decided at the moment of conception. Pregnancy is divided in 3 trimesters. First trimester, conception to 12 weeks. Second trimester, 12 to 24 weeks. Third trimester, 24 to 40 weeks. Conception. The moment of conception is when the woman's egg fertilized by the man's sperm. The gender and inherited characteristics are decided in this instant. Week 1. The first week is a volumestrial period because your expected birth date is calculated from the first day of your last period. This week counts as part of your 40-week pregnancy, even though your baby hasn't been conceived yet. Fertilization of your egg by the sperm will take place near the end of each week. 7 days after conception, the zygote burrows itself into the plump uterine lining. The zygote is known as biotopsin. Week 3, 30 hours after conception, the splats into 3 days later the cell has divided into 16 cells. After 2 more days, the zygote has migrated from the fallopian tube to the uterus. Week 4. The developing baby is under the grain of rice. The rapidly dividing cells as a process of forming to the various body systems, including the digestive system. Week 5. The involving neural tube will eventually become the central nervous system. Week 6. The baby is known as an embryo. It's around 3 minutes length. By the stage is exerting special hormones that prevent the mother from having the menstrual period. Week 7. The heart is beating. The embryo is developed as a placenta and amniotic sac. The placenta is burrowing into uterine wall is the access of oxygen and nutrient from the mother's bloodstream. Week 8. The embryo is now around 1-3 cm in length. The rapidly growing spinal cord looks like a tail ahead. It is disproportionately large. Week 10. The embryo is now known as fetus is about 2.5 cm in length. All the bodily organs are formed. The hands and feet, which is probably looking like knobs or dice, are now involving fingers and toes. The brain is active as brain waves. Week 9. The eyes, mouth, tongue are forming and tiny muscles allow for embryo to start moving about. Blood cells are being made by the embryo's liver. Week 11. The teeth battening in the gums, the tiny heart is developing farther. Week 12. The fingers and toes are recognizable but still stuck together with ribs or skin. The first trimester combined straining phase can be done around this time. The teeth checks for the trisomy 18 and trisomy 21. Week 13. The fetus can swim about quite vigorously. It is now more than 7 cm in length. Week 16. The fetus is around 14 cm in length. Eyelashes and eyebrows have appeared and the tongue has taste buds. The second trimesters, maternal serum screaming will be offered as the time the first trimester test was not done. Week 14. The eyelids are fused over the fully developed eyes. The baby can so mutely cry. Since it has vocal cords, it may even start sucking in stuff. The fingers and toes are going nails. Week 18 and 20. An ultrasound will be offered. The fetal morphology scan is checked for structural abnormalities. Position and placenta have multiple pregnancies. And interestingly, HICCUs in the fetus can often to be observed. Week 28. Your baby now weighs about 1 kilogram, 2 pounds, 2 ounces, and measures about 20 centimeters from crown to rump. The crown thumb to length is around 37 centimeters. The growing body has caught up with the large head, and the baby now seems made in proportion. Week 24. The fetus is around 33 centimeters in length. The fused eyelids now separate into upper and lower legs, enabling the body to open and shut its eyes. The skin is covered in fine hair and protected by of layer and wavy secretion. The body makes breathing movements with its lungs. Week 32. The baby spends most of its time asleep. The movements are strong and coordinated. It has probably assumed the head down position by now in preparation of birth. Week 36. The baby is around 46 centimeters in length. It has probably nested its head into the mother's pelvis, ready for birth. It is about born now. Its changes for survival excellent. Development of the lungs is rapid over the next week. Week 40. The baby is around 51 centimeters in length and ready to be born. It is unknown exactly what caused the onset of the labor. It is most likely a combination of physical, hormonal, and emotional factors between the mother and baby. Now that you know the stages of pregnancy, let's know some tips on how to have healthy pregnancy. Before you can take care of your baby, you need to take care of yourself. And you, unborn child, there's a lot of advice out there. Much of it's common sense. Your first step, as soon as you suspect you're pregnant, see your doctor and visit any nearby healthy center of your area. Tip 1. Take a prenatal vitamin. Tip 2. Exercise regularly. Tip 3. Write a birth plan. Tip 4. Educate yourself. Tip 5. Change your chores or avoid harsh or toxic cleaners, heavy lifting. Tip 6. Track your weight gain or normal weight gain is 25 to 35 pounds. Tip 7. Eat your foods with fiber. Tip 8. Eat your veggies. Tip 9. Eat 5 or 6 well-balanced meals each day. Tip 10. But don't overweight. You only need 300 to 500 additional calories per day. Tip 11. Keep a food diary. Tip 12. Limit caffeine. Step 13. Drink plenty of fluids. Step 14. Don't drink alcohol. Tip 15. Know when to call your doctor with concerns. Tip 16. Don't smoke. Avoid second-hand smoke. Tip 17. Get enough sleep. Tip 18. Practice relaxation techniques daily. Tip 19. Exercise but don't overdo it. Tip 20. Strength before bed to avoid leg cramps. Thank you. This is your speaker for today. I am Meriam Dacalos, first year college BSHM 1D.